Honorable James Macharia, Cabinet Secretary for Health, Your Excellency Ali Hassan Joho, Governor of Mombasa, Honorable Fred Seagour, Principal Secretary for Health, Deputy Governor, other county executives, distinguished guests, ladies and gentlemen, hamjambo, habari zenu. I'm very pleased and honored to be here with you today to commemorate World TB Day. Today is World TB Day, and today is an opportunity to remember all those who suffer from this terrible disease. It's a day to reflect on all we have done in the fight against TB. It's a day to recommit ourselves to defeating forever this scourge that causes such great suffering in Kenya and around the world. The rate of new TB cases has been declining worldwide for about a decade now. The trend can be attributed to improvement in essential healthcare infrastructure, such as the lab and clinic we just toured here at Port Reitz, and a trained health care workforce that is better at disease detection and management. Still, more work needs to be done. We can eliminate TB in our lifetime, but only if there is a strong joint commitment among governments, donors, civil society, and health workers. We can eliminate TB by working together on research, early diagnosis, and better access to treatment, advocacy, and social mobilization. And I just want to say thank you to the groups that put on the little plays, the little skits at the beginning. I agree very much with the Principal Secretary. Their messages were exactly right. And I think that that sort of outreach is very powerful. Kenya has one of the highest TB prevalence rates in the world. But Kenya has also made great strides in controlling the disease, surpassing the World Health Organization's TB targets by detecting 83% of the total estimated number of cases and successfully treating 86% of patients diagnosed with TB. Kenya has also seen a decline in the number of new TB cases reported each year. Despite these significant achievements, TB remains a major cause of illness and death in Kenya. The burden of TB is linked to the high prevalence of HIV in Kenya. Co-infection of HIV and TB is common and reduces the ability of people to fight both diseases. Poverty and limited access to health care services are two other major contributing factors to the high burden of TB in Kenya. In the face of the challenge of TB, what have we been doing and what are we going to do? The United States government has been a long-time partner with the government of Kenya in the fight against TB. And the encouraging World Health Organization statistics I just mentioned are a testament to this partnership and to the successes that it has had. Over the past 5 years, the U.S. Agency for International Development in Kenya has invested over 4 billion Kenya shillings in TB control and TB-HIV collaborative activities. For example, USAID and the U.S. Centers for Disease Control supported the implementation of the Ministry of Health's Strategic Plan 2011-2015, which resulted in over 1,800 laboratories being able to better diagnose TB across Kenya. It also resulted in better trained healthcare workers who were able to diagnose TB early and start patients on life-saving anti-TB medicines. By identifying cases early and treating new and existing cases, we can achieve a TB-free Kenya. We continue to invest in infrastructure, such as support for the construction of a new state-of-the-art TB reference laboratory in Nairobi. We also invest in research that's critical to improving diagnosis and treatment of tuberculosis. TB is one of the top 5 causes of death in children in Kenya, and it's especially difficult to diagnose in young children. Last November, I had the privilege to visit the Michelle Obama Children's Hospital in Kisumu and see the Toto TB study. This study, which is a collaboration of USAID, CDC, and the Kenya Medical Research Institute, KEMRI, is the most comprehensive study being implemented in the entire world to identify the most effective methods for diagnosing TB in children and to evaluate new diagnostic tests. It is an important study, and Kenya is leading the way. But today, I want to underscore our most recent investment in fighting TB in Kenya, our 5-year 3.5 billion Kenya shilling program known as TB Accelerated Response and Care, or TB ARC. Activities under this program are already underway, and in the past few months, over 54,000 TB patients have been diagnosed and their treatment has been started. In addition, 87 senior health care managers from all 47 counties have been trained in TB control under the program. As we go forward, TB ARC and the U.S. government, in partnership with the government of Kenya, aim to significantly reduce the burden of TB in Kenya by 2018. We can achieve this goal by increasing the number of new cases found and treated, strengthening lab services to diagnose the disease, investing in technology to improve TB data management, and focusing on children and high-risk populations. This is a joint effort, and it will be implemented in collaboration with the government of Kenya in alignment with the national health policies and targets set forth by this government, the Jubilee government, and in Kenya's Vision 2030. TB ARC is a local solution and thus will be implemented by a Kenyan NGO, the Center for Health Solutions, which is led by top-notch Kenyan health professionals. And the program goal is to increase the proportion of TB cases identified and treated to over 95%. The United States and Kenya have been partners for 50 years and have achieved much over time. And TB ARC is a great example of how Kenya and the United States work together for our mutual benefit. We look forward to our continued partnership with the government of Kenya in fighting tuberculosis, building on the achievements to ensure that every Kenyan has access to diagnosis and treatment for TB. The time to conquer TB is now, and working together, I know that we can do it. Thank you very much. Asanteni sana.